Welcome, everyone, to the presentation on Homeopathy for Children, Safe and Effective Remedies for Common Childhood Illnesses. Today, we'll explore how homeopathy offers gentle and effective solutions for various health ailments that children commonly face. Homeopathy is a holistic system of medicine that uses highly diluted substances to stimulate the body's natural healing processes. It is based on the principle of like cures like, meaning a substance that causes symptoms in a healthy person can cure similar symptoms in a sick person. Homeopathic remedies are safe for children of all ages, including infants and toddlers. They are non-toxic, non-addictive, and free from harmful side effects, making them ideal for use in pediatric care. Homeopathy works in harmony with the body's immune system, helping children to heal naturally without suppressing symptoms. I'm going to discuss common childhood ailments and the corresponding homeopathic remedies. Fever is a natural reaction and immune response when the body has an infection, allergy, toxic overload, or physical overheating. In children, fevers can go higher than adults, even in mild infections as part of a strong immune reaction. Homeopathy is one of the best, most natural ways to reduce a fever. Aconitum is given for fevers with the following symptoms: sudden high fever in the early stages of a cold from a draft, stuffy, burning hot, and dry nose with no discharge, sneezing and throbbing headache, dry throat, choking cough without the need to swallow, anxious and restless child with fear about minor illness or dying, burning thirst for cold water. Belladonna is given for fevers with the following symptoms: sudden onset after getting chilled or overheated, high fevers with a bright red, flushed, and hot face, dry skin, glassy eyes, and dilated pupils, semi-stupor or delirium, sweating on uncovered parts, sore throat, throbbing head, thirst for cold or lemon drinks. Fever is worse at night. Colds. The common cold has familiar symptoms, such as inflammation of the throat, sinuses, lungs, and bronchial tubes. Colds can be distinguished from the flu, which has greater feelings of overall achiness, malaise, and weakness. Pulsatilla is given for colds with the following symptoms: late stages of a cold with thick, yellow-green, non-irritating mucus and bad-smelling discharge, sneezing, nosebleeds, loss of smell, taste, and appetite, loose cough in the morning and dry cough at night, little thirst, greasy taste in the mouth, changeable symptoms and moods, weepy, craving sympathy, and snappish, worse in the morning, evening, in heat, but feels chilly, and in a stuffy room, better in the open air. Arsenicum is given for colds with the following symptoms: watery, acidic, drippy discharge from the nose that burns the upper lip. Nose feels stuffed up, not relieved by sneezing, with burning dry nostrils. Throbbing headache with light sensitivity, restlessness, chills, anxiety, and nervousness. Takes frequent sips of cold water, fear of serious illness and death. Worse in the open air and after midnight, better in a warm room with warm drinks. Heparin sulf is given for colds with the following symptoms: sore throat with sharp, splinter-like pains, feeling like a fishbone in the throat, sensitive to touch, stitching pain in the ear when swallowing, hawks up lumps of foul mucus, hearing blocked, speech affected, difficulty swallowing solids, liquids are okay, irritability, and angry impulses. Very chilly, sensitive to pain, worse with touch, cold drafts, and at night. Better with warm drinks and craves sour foods. Ear infection or otitis media is the #1 childhood health problem in America, generating millions of doctor visits and costs. Antibiotic use has been shown to double the rate of ear infections. Allergy seems to be the major contributing cause to otitis media, with allergies to food such as dairy wheat and corn causing fluid retention in the eustachian tube. Homeopathy has an excellent track record in otitis media, along with nutritional therapy and elimination of allergens. Pulsatilla. Ear is hot red and swollen, with severe stitching pain, roaring sounds, and itching. Yellow thick discharge. Deafness stopped up feeling pressure outward. Especially after colds perfuse yellow mucus, little thirst, and dry lips. Gentle, timid children that want sympathy and attention. Silicea. Chronic offensive pus. Shooting pain, itching, tingling, and worse swallowing. Stopped up, frequent popping, roaring sounds, hard to hear voices, sensitive to loud noise. Profuse sweats of the head, timid, fearful, lack confidence, but gets stubborn, rigid, and defiant. Easily exhausted, weak, worse with cold damp, better with warm wrapping. Nausea can occur from local irritation and toxicity in the stomach, indigestion, bad food, bad odors, various drugs, food additives, and food sensitivities. Nausea from any cause can lead to vomiting of food fluids, of empty vomiting, dry retching. Causes of persistent nausea need to be investigated, preferably by a holistic doctor. Nux vomica. Difficult to vomit, much strain, dry retching, vomiting of sour or bitter mucus, or bowel. Cramps, anger, and irritable, critical, driven personality from overeating or milk. Worse after eating, mourning and motion. Better after vomiting and lying down. Ipecacuanha. Constant nausea not relieved by vomiting. Cutting pains and cramps may vomit shiny mucus food, bile, or bright blood. Much salivation, sinking or hanging loose. Feeling in the stomach, no thirst. Nausea after fruit, pork, rich foods, or sweets. Worse with overeating, the smell of food, motion, warmth, and smoke. Better open air. Homeopathic remedies are available in various forms, including pellets, tablets, liquid dilutions, and creams. They are easy to administer to children, either dissolved in water or placed directly on the tongue. For the remedies and illnesses mentioned here, the potency of 12C or 30C can be used. For severe cases, a dose of 12C or 30 Cg potency can be taken every 15 to 30 minutes, for the first hour or two, reducing the dose hourly with improvement. In chronic cases, 1 to 3 doses daily can be sufficient for 1 to 3 weeks. However, dosing can vary depending on the condition. If you have any concerns, please consult a qualified homeopath or healthcare provider for personalized advice. Homeopathy can complement conventional pediatric care and provide an alternative or adjunctive approach to managing childhood illnesses. Parents should also educate themselves about homeopathy and its principles to make informed decisions about their children's health care. In conclusion, homeopathy offers safe, gentle, and effective remedies for common childhood illnesses. By addressing the root cause of symptoms and supporting the body's innate healing ability, homeopathy can promote optimal health and well-being in children. Thank you for attending today's presentation on Homeopathy for Children, Safe and Effective Remedies for Common Childhood Illnesses.